All right, calcitriol. So there are several organs in play here, and this is the kidneys, and this is your stomach and your small intestines and large intestines. So this is also known as your digestive tract, aka your gastrointestinal tract or GI tract for short. Now, the thing is that calcitriol, I'm representing it by this cartoon here, is made in your kidneys, and it's actually made from vitamin D. So yet another reason why vitamin D is important. Now, here what we have here is that calcitriol, what happens is that it increases your calcium and phosphate absorption from your food. So remember, two big components of calcium or bone mineral are calcium and phosphate. So what does is send all these signals to the GI tract, especially your intestines, and says, hey, if there's any calcium, we want more of that in your body. So if you have something that's like okay, I know some people don't eat dairy, but hey, that's another benefit of dairy. If it has a lot of vitamin D and a lot of calcium, then that helps to increase, it's like a double dose of like calcium because you get not only get the calcium from the dairy, but you also get some of the hormone that helps to increase your absorption of calcium from the dairy. So as it passes through your GI tract, it releases, or your GI tract absorbs all the calcium, and your gastrointestinal tract actually has a lot of blood vessels leading from it. And this is how you get all the nutrients from your food into your blood. So all those blood vessels that are connected to your GI tract, so these are the ones that carry nutrients that you'd absorb and digest into your blood and to the rest of your body. So if calcitriol is increasing the calcium and phosphate absorption from your food, you're going to have increased levels of calcium in your body. So calcitriol's over effect is increasing your blood serum calcium levels. Now there's something called calcitonin. Now this is one of those where it sounds like it only differs by a few letters, but again, it's like abduction and adduction. Just that change in a few letters can mean something totally different. So calcitonin is a completely different hormone. And there's also something called parathyroid hormone. So here's the thyroid gland. We didn't cover in detail, or actually I think we talked about maybe when we talked about the hyoid bone, but the thyroid gland. So here we have your larynx, and or okay, the common name is like your voice box, and then you have your trachea or your windpipe. Then you have your thyroid gland. And this thyroid gland, actually, if you look at the back and posterior of it, it has these four little bean-like things called parathyroid glands. So these glands actually make parathyroid hormone. And actually, calcitonin is made from, so the thyroid makes thyroid hormone, but it also makes calcitonin as well. So you actually get both of these from the thyroid and the parathyroid glands. So again, the parathyroid glands are not the same thing as the thyroid glands. Okay, so what does parathyroid hormone do? So one thing is like here we have that multinucleated osteoclast. Remember, osteoclasts are all those like special macrophages that fuse together to make one big cells. And let's ask the chat. Do osteoclasts break down bone or do they build bone? So osteoclasts, do they break down bone mineral or do they build bone mineral? Yes, looks like you got it. They crush and break down. So this is the cool thing about osteoclasts. Not only are they there to get rid of like damaged bone and break it down, what they also can do is so the thing is that remember when that pie chart showing all the bone mineral and how much of your blood's or body's calcium and phosphate are from your bone? Well, the thing is that your bone mineral is also a big bank and reservoir of calcium ions. So the thing is that parathyroid hormone actually tells these osteoclasts to increase their activity. So they're going to break down, and remember osteoclasts crush. They crush and break down bone, but when they break down bone, where are these calcium ions going to go? They're going to go into the surroundings, and they're going to go into your bloodstream. So this is one effect. They activate osteoclasts, and the osteoclasts, when they break down bone mineral, they release calcium into the surroundings, and that ends up in your bloodstream. Then it also does something else. Parathyroid hormone actually increases the calcium absorption in your GI tract. So not only so if you have both parathyroid hormone and calcitriol and parathyroid hormone, they both increase GI absorption of calcium. Now, here's the kidney. So the thing is that your blood filters through your kidneys, but what does parathyroid hormone do? Well, one thing it does is, remember, calcitriol is made in the kidneys, and calcitriol also boosts your calcium absorption from your GI tract. So calcitriol from so parathyroid hormone causes calcitriol to be produced. Calcitriol tells the GI tract to increase the amount of calcium that's absorbed from your food. So you get even more calcium being absorbed if you have both parathyroid hormone and calcitriol. So the thing is that your kidneys, not only are they important in making calcitriol, they're what filter your blood, filter out waste and excess things, like if there's excess sodium, excess water, anything excess, then your kidneys are very important in regulating and kind of getting rid of excess or kind of balancing your blood chemistry. Now, the thing is that calcium, if left by itself, it will filter out through the kidneys, but if you have parathyroid hormone, it actually promotes the recycling and reabsorption. So calcium can end up in your urine, but if you have parathyroid hormone in the equation, it actually promotes the recycling of calcium back into your blood. Now, calcitonin, again, don't get confused with calcitriol. So calcitonin pretty much flips everything upside down. It does pretty much the opposite of parathyroid hormone. So calcitonin right here, instead of activating osteoclasts, it's going to tell them, hey, chill, take a break, stop breaking down bone. So if you have decreased osteoclast activity, I don't have the osteoblasts in this cartoon, but the osteoblasts are going to dominate. So they're going to take calcium from the blood and put it into bones. So basically what you're having is calcium being removed from the blood and being deposited onto bone if the osteoclasts are taking a break. Another thing it does is affects the GI tract. So it tells the GI tract to stop absorbing as much calcium. So if you don't get calcium absorbed from your food, you have less calcium in your blood. And then it also tells your kidneys to, one, stop making as much calcitriol, and two, it also allows your kidneys to actually excrete more. It promotes the excretion of calcium in your urine. So remember, blood filters through your kidneys and makes urine. So if all that calcium is not being recycled back into your blood, it's going to end up into your urine. And what happened? Well, notice that there's a drop in calcium levels in your blood. So those are the three, in terms of calcium levels in your blood, those are the three hormones you should know. And these are the organs and cells you should know. So don't go further than this.